So today I wanted to talk about osteoarthritis. So that just means inflammation of the joint involving a bone. Those are all the Latin bases. So arthros, joint, itis is inflammation, osteo is bone. This is basic run-of-the-mill arthritis that almost everybody is going to get at some point. I'm Dr. Meredith Warner. I'm an orthopedic surgeon in Baton Rouge, Louisiana, and I have an orthopedic surgery and wellness practice where we're proud to offer the latest and greatest and most tried and true methods of treatment for different problems that hopefully are mostly non-surgical, because I'm a big believer in the body healing itself and empowering people to take care of themselves. We do surgery, we do injections and things like that, but we really try to help people get better without surgery if it's at all possible. And so today I'm going to talk about arthritis and some of the more natural ways to treat arthritis, because it is so common, and as of yet there is no cure for this disease, as prevalent and disabling as it is. These are some shots from my clinic, and you can see we've got a really nice gym where we do a lot of physical therapy. We actually do some yoga in there as well. You can't see it in this image, but we actually also have a full body infrared sauna, which has been shown in multiple studies to help treat pain and modulate cartilage function. And then we have a variety of practitioners. So I've got a podiatrist that treats all the arthritis of the foot and ankle, myself, orthopedic surgeon, we've got a physical medicine and rehab specialist, and a nurse practitioner who helps us with all of our wellness work on the primary care side. And also we have an aesthetic service and, of course, an amazing team of physical therapists. Really, I couldn't achieve my goals of non-operative treatment of people without my team of PTs. They are invaluable. So let's talk about arthritis. One of my favorite topics, because it's fascinating. It's been studied for forever, and we still can't seem to figure out how to cure it. Sort of like cancer, if you think about it, although they're making a lot more headway, I think, in cancer treatment than in arthritis. So what is it? So arthritis can affect all joints. This is a joint problem. This isn't a problem of the long bones. It's not a problem of the muscle or the tendons, although the tendon and muscle surrounding a joint can play into it. This is a joint problem. And what is a joint? A joint is where two bones meet to form an articulation or a movement. So this is your femur, this is your shin, this is your kneecap, so this is the knee joint. Arthritis is a disease of joints, okay? It can affect every joint in the body, from the foot to the spine to the knee to the shoulder to the fingers, okay? It's generally a degenerative condition. That means it is a not so much, but it's sort of a breakdown of the structural integrity of the cartilage over time. And it's caused when the cartilage, which coats the surface of the ends of the bone. So in order for this bone to move smoothly, okay, and not crunch and creak and crack, you have to have a lubricated, low friction, firm surface, right, that lets them slide on each other. Just like you can't have a ball bearing without oil. Like it would catch up and metal would freeze in place and you would have no motion. The knee joint, the ankle joint, the spine joints, whatever, all require a coating of cartilage, specifically hyaline cartilage, and then a nice firm subchondral plate, and then it has to have enough fluid in there to lubricate the motion. Cartilage is one of the lowest friction substances that we are aware of. So what happens in arthritis is that low friction, smooth surface becomes not smooth. It becomes high in friction. It gets pitting. It gets cracks and fraying. And then that's when you start to hit the subchondral plate underneath and it begins to hurt. So the cartilage effectively gets worn down or degenerates away or is removed for some reason, such as trauma, we'll say. It's the most common form of arthritis, osteoarthritis. Now, what other arthritises are there, you might say? Well, there's arthritis of lupus, there's rheumatoid arthritis, there's infectious arthritis. Some people get bad arthritis from a septicemia, meaning a bloodborne infection. There's a number of different ways that you can have damage to the cartilage of the joint. But today we're talking about basic osteoarthritis, which is more or less genetic and environmental in nature. Very common, typically starts to present symptoms in the 50s, and usually very slight tilt towards women more than men having it. The trick with arthritis is it actually starts to develop much earlier than the people begin to notice symptoms. So if you keep that in mind and you understand the nature of arthritis, you could actually probably prevent a lot of problems for yourself in the future. So why does it hurt? So cartilage does not have any nerve fibers. Cartilage is aneural. That means even though the cartilage is damaged, we should never know that because the brain has no way of knowing that because there's no neural connection to cartilage. What happens is the cartilage breaks down and you crack that subchondral plate, the firm surface where the cartilage sits on it, and then that is what starts to hurt. Okay, so as long as you never get to that stage, you're probably not going to have a ton of pain with arthritis. This is probably why you feel symptoms later. Of course, there's a whole host of other problems, ligament stiffening, muscle weakness, and all of those play into pain, and we'll talk about that. But basically, the molecular basis of pain is that you have different inflammatory cytokines or proteins that the body releases when it senses damage or irritation. Tumor necrosis factor alpha, which is also very high on rheumatoid. Interleukin 6, interleukin 1. And you may have been seeing these in newspaper talking about virus and things like that, because these are the same inflammatory mediators that are used to fight pathogens. Well, unfortunately, when you have an injury in the body, or if the body believes there to be damage, it will send out the same group of soldiers or the same group of cytokines to get to that area and sort of fix it. But with arthritis, it ends up just causing more pain and more tissue damage. And then mast cells, which are a big type of, I guess you could think of it like a white cell, sort of releases these things into the area when there's a signal to the body that there's inflammation. So you have cartilage breakdown, subchondral plate fractures, signals to the body there's inflammation. All of these inflammatory mediators go out and they induce pain and induce further tissue damage. So our drug philosophy is a pharmaceutical industry. There are different drugs for different sorts of pain. And as you probably know, and I know, there's really no, well, let me modify that. There's to date been no great treatments for pain, but I think that medical marijuana and some natural things are starting to show a lot more promise. Traditionally, for peripheral and neuropathic pain, meaning, you know, like you bang your hand with a hammer, that's nociceptive pain, versus you have diabetic neuropathy, that's neuropathic pain, or you have shingles, that's neuropathic pain. So there's different classes of pain, and then whether they occur way out in the fingers or are they central. And so we have different drugs. So we've got opioids, which we all know that those aren't great. I mean, they're good to mask the pain and make you forget you have pain, really don't do anything for the root cause of your pain, and they certainly cause a lot of problems. There's the anti-inflammatory group of medicines, non-steroidal anti-inflammatory drugs. These are good because they're non-narcotics, so they're not addictive, but they certainly are bad for the heart and bad for the gut. Different ones are worse for the heart, different ones are worse for the gut, and all of that varies and depends on your condition. But in general, they do have decent side effects and should be avoided if you can. In fact, in the older population, 65 and plus, one of the most common reasons for visits to the ER is like GI problems, GI bleeds, stomach ulcers, things like that. And a lot of those are caused by anti-inflammatory medications. And also they damage the kidney over time. So again, they're great medicines, they work, ibuprofen works, but you don't want to take it forever. You certainly don't want to take it every day forever. And then you've got different things like tricyclics and selective nerve root inhibitors or serotonin selective reuptake inhibitors. And what are these? These are antidepressants. Well, how do they treat pain? Well, remember, all pain is an electrical signal from somewhere in the body that goes to the brain. The brain's your central processing unit, and it interprets that electrical signal. Well, the brain is also where mental health comes into play. And there's only a certain number of proteins that are used in these signaling pathways. And pain and depression share a lot of the same signals or a lot of the same proteins that pass the electrical signal on from neuron to neuron. So some drugs that treat depression and anxiety actually are very effective at treating pain. One of these is Cymbalta. I prescribe that fairly often for people that have chronic pain. And then you've got the alpha-2 delta ligand anticonvulsants. That's your gabapentin, your Lyrica. These are drugs more for nerve pain. And as I've said before in other talks, they work, they treat the pain, but the problem is the side effects again. So the side effects of these drugs are somnolence or falling asleep very easily and weight gain. So we don't want those either if we don't have to take them. But they're non-addictive, they work well, and generally speaking, they're safe. So there's a whole host of different pharmaceuticals that are available for pain, but by and large, the side effect profile, a lot of these are not awesome. Recently, I've been making a lot more recommendations for medical marijuana because that is a natural compound that has none of these side effects to date and is very effective if used judiciously. which really sort of reinforces my philosophy that nature is kind of the best way to handle problems. So if you can harness your natural ability to heal or the natural plant world, i.e. a plant-based diet, you'll probably be doing better with fewer side effects. But these are the drugs, these are the principles, they do work, they just have certain side effects, and you just have to keep them in mind. So here, let's talk about a few ways natural things can modify these complex pain pathways. So resveratrol, this is the source of the so-called French paradox, and that's when people, one author in particular, wrote a study showing that the French, despite having a high-fat diet, had less cardiovascular disease and lived longer and healthier. And they believed it was because of resveratrol in the grape skins from red wine. This is a so-called long life hormone, or longevity, not hormone, sorry, flavonoid. It basically can block anti-inflammatory mediators and antibodies that damage cartilage. It'll actually assist your brain in growing new neurons, believe it or not. It's one of the few things that can do that. And this is one of the only plant-based phytochemicals that we know of that actually upregulates the longevity genes, the SIRT genes, so-called, SIRT1 and 2. And it also decreases damaging inflammation over time. So resveratrol is an amazing phytochemical. You can't take too much of it. You can't take too little of it. It's got to be right in the middle. But it's an awesome medication, and it will block the inflammatory mediators and the damaging antibodies that cause that pain signal to your brain from the damaged cartilage. Tart cherry extract's another one that I love, that I recommend a lot. It is a very strong antioxidant, and it actually acts like Celebrex, which is one of those non-steroidals we talked about. It'll actually decrease the COX-2 enzyme. That's the cyclooxygenase number 2 enzyme. That is integral in the pathway of inflammation. So that is why it's anti-inflammatory. It stops the production of the inflammatory cytokines that hurt, similar to Celebrex, without the GI side effects, without the kidney side effects, and without the cardiac side effects. It's also an antioxidant, so it'll help you detoxify free radicals and oxidative stress. And then it'll decrease TNF alpha. That's one of those cytokines we talked about that is elevated in a hyperinflammatory state, as in osteoarthritis. So these are two natural phytochemicals of many that I love that work just as well and have been studied head-to-head against a lot of our standard meds. And they have a really good track record for treating the pain of arthritis. So again, here's what happens. You get a damaged joint. You have the release of the inflammation, the release of the chemical mediators and cytokines that hurt. Not only do they hurt, but they eventually do what's called, if it's ongoing long enough, you'll have what's called peripheral sensitization. And that just means that your peripheral circuits, the nerves, start to become a little bit too sensitive. So things that should not hurt start to hurt. Things that should stop hurting quickly don't. And then it, over time, can actually make changes in the central nervous system. And a lot of our drug pain treatment activities are in an effort to stop that peripheral sensitization, to stop the damaged joint tissue, or to capture and stop the inflammatory chemical mediators between the two. And then some of them are just to mask the signals in the brain, like the opioids. So you take a narcotic, your brain sort of thinks it's doing okay, and you feel good and you have euphoria, right? But you've done nothing to fix the problem. Same thing with the anti-inflammatories. All they're doing is in the middle part there, the inflammatory chemical mediators, they just stop one part of the pathway, leading to more of the cytokines, like the COX-2 inhibitors, the COX-1 inhibitors, ibuprofen, Celebrex, so on. And then you've got some anesthetic type medications, lidocaine and whatnot, you can put patches on that numb you up. And those are just sort of a circuit breaker. So they just block the signal, but again, aren't really doing anything to help the cartilage or the joints or the muscles around the cartilage. And then we've got injections like steroid and rooster comb or hyaluronic acid. Hyaluronic acid is interesting because it is a molecule. It's a building block of cartilage is how I try to think of it. It'll actually increase the thickness of the lubricant in your joint. It'll reduce a little bit of the inflammation, and it'll give some nutrition to cartilage, which, remember, I said cartilage doesn't have a nerve source. Cartilage also does not have a source of blood. So the only way cartilage gets nutrition is by diffusion. So sometimes you can give a supplement with a rooster comb injection and give it a little bit more nutrition. And these are all of our more standard methodologies to treat the pain. Is there a question? We have questions. Resveratrol. I mentioned tart cherry and resveratrol. Oh, I personally take 1,500 milligrams of tart cherry every night. You need to take it at night because it does have a bit of melatonin in it naturally, so it will make you a bit sleepy. But, you know, like let's say I try yoga and I'm a little bit sore, I might take an extra 1,500 milligram of tart cherry. But usually 1,000 to 1,500 milligrams a day should be enough, but you can take a little bit more short term if you need to. And then the resveratrol, I've kind of locked into the 500 milligram range, somewhere around there, just so that you get enough to get the health benefits, but you don't get so much it becomes toxic. So those are based on my research, what my recommendations are. All right, now what does arthritis feel like? You may be sitting at home wondering, do I have arthritis? Well, the only way to really know is, I guess, a cartilage-weighted MRI scan, in theory. You can pick up some of it from x-rays if it's far enough along. But the symptoms are sort of a deep aching pain within the joint, more pain and soreness at the end of the day. And then as it progresses, some people will just have like sort of a stiffness in the joints, and it's hard to get moving. Once you get moving, things get better, okay, as you get a little bit more flexible and you start to diffuse the nutrition to the cartilage. Some people will develop weakness or dysfunctional muscles around the joint, and then they start to limp or have abnormal walks. And then swelling. So if you have stiffness, swelling, cracking and popping from the spurs that sometimes form with arthritis, and any kind of joint deformity, you might have arthritis. You probably have to go get an imaging test to really know. But generally it's aching pain, swelling, stiffness, gets a little bit better as you move it. But if you move it too much, sometimes you have soreness afterwards. Those are sort of what patients tell me it feels like. Hold on. Okay. So again, I put this picture of the lady getting out of the car. So like hip stiffness and knee stiffness. You sit in a car for like a 3-hour drive, let's say you're going to the beach, and then you get out of the car and you can barely stand up because your hip is so stiff. That's sort of how I think of as arthritic pain. The way to fix it is to get stronger and more flexible, and we're going to talk about that, and that's what that secondary image is. So if you notice that after periods of immobility that you're a little bit stiff, a little bit achy, not quite right, you may have arthritis. Next slide. All right. So what are the risk factors and how do I keep myself from getting arthritis? Other questions I get a lot. So one of the risks of developing arthritis, because remember this is a degenerative chronic inflammation, oxidative stress buildup problem, is age. So the alternative to age is not a good alternative. So we're all going to age, hopefully, and age well and long. But that as you get older, this is when you may or may not begin to see symptoms. So that's the primary risk factor probably. Injury. An injury can cause arthritis if it actually cracks through the cartilage. Just simple falls, sprains, things like that generally don't lead to arthritis. But if you actually crack the cartilage, like with a real fracture through a joint, that can potentially happen. Obesity. Obesity is one of the primary reasons people get arthritis in our country and in the Western world, because fat cells on a 24-hour-a-day, 365-day-a-year basis produce adipokines, which are like cytokines, and they damage joints, and they induce inflammation, and they cause pain. So obesity is a problem, not so much because of the load or the heaviness, although that contributes. It's really that you are effectively attacking yourself with inflammation, and it never stops. And then women are more likely than men to develop symptoms as they enter menopause. And of course, what does that make you think of? Hormones. Hormones have a great deal to play, testosterone, estradiol, estrogen. So having a full metabolic and hormone workup, which we do for people all the time, can certainly help trying to figure out how to get your symptoms right. And then a bad diet, being around toxins, pollution, anything that causes chronic inflammation and oxidative stress, which is really the root cause of osteoarthritis, that's going to give it to you. So if you eat fast food often, you're obese, and you're starting to get a little bit older, the odds are you're going to have arthritis and you're going to have symptoms from it. But the good news is almost all of these risk factors, with the exception of age, are modifiable or preventable or changeable. Okay, so let's say you're in a group that's a risk factor, and I did not mention one big risk factor is smoking. So if you're a smoker, please quit. Hold on, we have another question. Osteoarthritis in my wrist, but does inflammation cause plantar fasciitis as well? The question was from somebody that has arthritis in their wrist, and they asked if inflammation will also cause plantar fasciitis pain as well. The short answer is yes, but it's kind of complicated because plantar fasciitis is not acute inflammatory pain. It's from chronic inflammation and oxidative stress, where the connective tissue of the fascia starts to break down and become disorganized and release painful things like substance P, which causes pain. So again, the same root cause, chronic inflammation, oxidative stress, elevated levels of damaging cytokines will cause cartilage damage in the wrist and connective tissue damage in the foot. So the short answer is yes, they're sort of related and can both be inflammatory, but not acutely inflamed. Like acute inflammation is like when you cut yourself, it swells, it gets red. Well, that always goes away, right? After just a few hours, usually. That's acute inflammation. That's good. We need that in our systems. It's the chronic inflammation we don't want. So what can you do to prevent arthritis? Remember I told you about the modifiable risk factors. We don't want to modify aging, right? Because none of us want to stop aging. If you stop aging, that's not a good thing. What you want to do is age well. So exercise. And this kind of scares some people and they get turned off and they just want to turn the webinar off and go away. I'm not talking about going to CrossFit. I'm not talking about regimen fitness or F45 or all of these fancy aggressive or Orange Theory. You don't have to do all that. There's a lot of literature on exercise, a ton of data. I just read a really great book from a Harvard professor on exercise. I think the title was Exercised. Really, all you need to do to age well and keep your joints healthy and your muscles and ligaments is walk, believe it or not. You walk a few times a week, and then you lift weights maybe twice a week for your bone health and to prevent what's called sarcopenia, which is the loss of muscle as you age. That's really all you have to do. Now, if you want to add yoga for flexibility and balance strength and core strength, more power to you. That's awesome. But at the end of the day, if you want to age well, the bare minimum and really almost all you have to do is walk a few times a week and maybe lift some weights a couple times a week. So don't get turned off by exercise. It is totally doable. Protect the joints. So that's where the yoga and the balance strength comes into play and flexibility. If you have a super tight hamstring, your quadricep, which is the muscle that extends your leg, maybe I better show you this way. The quadriceps here, and that's what extends your leg. If you're really tight back here on your hamstring, well, guess what? This quad has to work, and it puts a ton of force between your kneecap and the femur, and that causes more arthritis. So flexibility where you have tight muscles is key. And so, for instance, my physical therapist can offer stretching programs for people. We can put people in the infrared spa, get you warmed up, stretch you for 5 or 10 minutes, and you're on your way. So there's a lot of ways to address these problems, but joint protection is key. Wear decent shoes when you're working out, and that's going to depend, of course, on any foot pathology you might have. But there's certain shoes that are highly shock absorbent for walking. And then stretching, as we said, and then core strength, not just in the spine, but foot core strength matters, and hip core strength is huge for helping you prevent the symptoms of arthritis. And then what I tell people to do is have just a baseline level of anti-inflammation in your life. You know you're chronically inflamed. I am. If you live in the United States of America, especially if you live in Louisiana, you are surrounded by pollution and toxins. Your diet is not good. You're not eating enough fruits and vegetables, and you have too much oxidative stress and chronic inflammation. So I try to take as many different types of antioxidants as I can to combat the different types of oxidative stress that occur at a cellular level. And I give myself a baseline of this. And then hopefully you don't need as much of the other drugs that we talked about before. I'm not saying you might not ever need them. I prescribe these things every day, but hopefully you'll need fewer and fewer, and therefore will have fewer and fewer side effects, and you'll just start to feel better. We have another question.
How often should I get scanned for osteoporosis and osteoarthritis?
Okay, this patient had a question of, this person had a question of how often should you get scanned for osteoarthritis and osteoporosis. So the first question is, there's no recommendation on getting scanned for osteoarthritis. That's really more of a symptom problem. So if you start to have pain in your knee or your hip, that's when you go see an orthopedic surgeon. and we will try to figure out if it's arthritis, usually with a basic x-ray, okay? Osteoporosis is different. Osteoporosis is the age-related weakening and thinning of bone that puts you at risk of fractures. That, I think the current recommendations are you get a bone density scan every 2 to 3 years, and of course, all of that's insurance dependent, right? So you get a bone density scan periodically. And also for all of my patients, I check their vitamin D levels a lot, particularly before surgery or if they're having unexplained bone pain. And a lot of bone pain, particularly after total joint replacements, can actually be simply from low vitamin D levels because it makes the bone more prone to microscopic injuries and pain and arthritis, right? Like release of inflammatory mediators. So osteoporosis is screened about every 3 years. Arthritis is just symptom dependent. How much vitamin D should postmenopausal women take? That's a question. So if you read the literature, the recommendations are kind of all over the place. Most people that believe in taking supplements for optimal health and not for the bare minimum where you don't get rickets would tell you about 3,000 to 5,000 international units a day. Because most of us are D deficient. Postmenopausal women are the highest risk group for osteoporosis and fragility fractures. I take 3,000 international units every day, and then I've added 5,000 units on top of that for a short term, and I do that during flu season for a couple months, and then I'll go back to 3,000 units a day. But I was very D deficient before and had to go on prescription strength, which was 50,000 units once a week, and I prescribe that for people all the time. We're very D deficient in this country, and it is a source of a lot of pain and fractures. So I would say anywhere between 3,000 and 5,000 international units a day.
And then the best anti-inflammatory supplements for inflammation.
Somebody's asking, what do I think are the best anti-inflammatory supplements for inflammation? Yeah, I'm going to talk about some of the natural medicine products I've actually put out there for that reason. But you probably heard of some of them. Turmeric is awesome. Tart cherry, we already talked about. PEA or CBD, both of which act on the endocannabinoid system. CBD is very, very anti-inflammatory. Ginger, resveratrol, omega-3 fatty acids. Those are some of the best ones. I've put people on prescription strength omega-3s just for pain, and it works. 3,000 to 4,000 grams a day for a short term. It also reduces triglyceride levels and generally makes you healthier. But now let's talk about the older methods of treatment, okay? Some of these work. They work great. And most orthopedic surgeons will, you show them an x-ray of a knee, they're going to say you need a total joint replacement. Maybe they're not wrong. My mom finally had one. She's, 77? But we were able to effectively get her that far naturally until she finally got the joint replaced. And she had a pretty decent recovery. She actually had a same-day surgery, and it went really well. This was in Delaware. But anyway, the old methods of treatments are steroids, which are cheap, and the FDA lets us put them anywhere for any reason. But I personally think the side effects and the damage at the genetic level, believe it or not, to the tenocytes that make tendons, the fibrocytes that make fiber and fascia, the chondrocytes that make cartilage, and the osteocytes that make bone. Steroids actually change the genetic signaling there and cause a whole host of problems long term. Short term, it's an awesome Band-Aid. I'll use Toradol a lot, which is sort of like a liquid ibuprofen injection. The anti-inflammatories we talked about, the narcotics. One thing that I've started to do for people, like I said before, is marijuana, which is a more natural way to handle pain and inflammation. It seems to be working really well for people. But these are sort of the older things: injections of steroids, anti-inflammatories, narcotics. The American Academy of Orthopedic Surgeons supports the use of tramadol for arthritis, which is a narcotic, more than they support anything else. And then joint replacements. All a joint replacement is you literally resurface the joint. So just like after a hurricane, you have flood damage of the floor and you got to resurface your floor. Cartilage, consider it flood damage to your joint. You got to go in, take out the old floor, put in a new floor. So you're literally slicing off the ends of the bone, putting metal on, and then there's a plastic piece between to sandwich them. And that's what a total joint replacement is. They work pretty well. They last for a long time, but a lot of people still have symptoms and issues, so it's always best to wait until you can't stand it anymore to get a joint replacement. The downsides, of course, the cost of surgery, and all of that is insurance dependent, right? If you have a high deductible plan, it's really expensive. If you have a low deductible plan, not so expensive. Some insurances let you get joint replacements, some don't. Some make you do 6 months of therapy first, some don't. It's all over the map. They require extensive amount of recovery post-op, and that's even when things go really well. And then people still have problems after surgery and injections. Up to 20%, probably more really, after total joint replacements of knees and hips have issues that they hate. Most people are satisfied and happy with their total joint replacement, so I will say that. So when it is time to do it, it's probably time to do it, and your physician will guide you with that. Again, I said it at the beginning of this talk, there's no cure for arthritis. So think about this. What's our best that we have to offer in Western medicine? Okay, let's just chop out the joint and put in a metal and plastic sandwich. That's the best we've got. So we have a lot of room for improvement in the treatment of arthritis. My goal and my interest is in trying to get the human machine to function optimally for you and to reduce the root cause of the symptoms of arthritis and hopefully even make the cartilage better. And that's with all the natural things and some regenerative treatments. Okay, so how do you do it? What do I do? So some people, I'll do platelet-rich plasma injections, which is when I take their blood and centrifuge it. I separate the white cells that have all of the cytokines for healing and the growth factors, and we actually will target those injections and put them where they're needed. Now, the literature, there's no consensus on this. Nobody does PRP exactly the same way, and a lot of the studies are hit or miss, but more and more data, when it's a good study, is coming out showing it's at least equivalent to hyaluronic acid injections and steroid without long-term side effects, and with the potential for actually healing. Steroids are never going to make you heal. PRP can. Above PRP are things like connective tissue matrix injections, which are actually derived of amniotic tissue after a donated sac from a live birth. This is nothing about embryos or anything, but you actually get a donated amniotic sac, and now it's able to be processed into an amazingly anti-inflammatory pro-growth injection that it has some regenerative capacity, meaning it can help you heal tissue, make good tissue, make your cartilage better while reducing pain. Stem cells, which we're not supposed to be saying stem cells, but rather mesenchymal progenitor cells. It's a mouthful, but basically these are the cells that can differentiate into different types of cells. They're usually in your bone marrow. So you get one of these cells, you put it into the cartilage area, and it should differentiate into a chondrocyte. If it doesn't do that, it releases from itself exosomes, which are little sacs of growth factors, and helps your body then go on to heal itself. And now some people are actually going further than the mesenchymal progenitor cells or stem cells, and they're actually capturing the exosomes and making that a separate injection. This is kind of big in the facial plastics world right now. So everything starts in facial plastics and then permeates to the rest of us, is what I've sort of learned. So we're going to start to see more and more exosomes. So we do all of that. We do PRP, we do mesenchymal progenitor, bone marrow or otherwise derived. We do exosomes, we do connective tissue matrix injections, and then all the natural medications. And then of course the physical therapy and yoga, because I think you can treat a lot of these symptoms and save yourself a lot of grief from a big surgery with simple methods that are proven in the basic science literature, a lot of animal studies and more human studies. I'm a huge fan of yoga. I wish I was able to do it more often because it definitely benefits me and any muscle pain I have. It's awesome for arthritis because of the flexibility and the strength and the core strength we talked about, and balanced strength. And then of course, reducing your overall inflammation with a better diet, i.e. the more plant-based, the better. I'm a huge fan of the Mediterranean diet. I gave a talk on that before. I'll probably do it again. But if you can just eat right, I guarantee you'll feel better because you are what you eat. It is so true. And then exercise, like we talked about, and you don't have to be a hero. You can just go for a walk. Flexibility and strength. So we started to talk about this during our technical glitch. Osteoarthritis can be controlled if you improve your joints function. So one of the problems with arthritis is sometimes this is a well-aligned knee. Sometimes you get a deformity, right? You're a little bit tilted this way, you're a little bit tilted this way, you've got a contracture here, you hyperextend. All of those can lead to abnormal loading patterns, and that increases contact stresses on the cartilage, and then you break down to the subchondral plate, the cytokines are released, the inflammation, and you have the pain. So if you can get balance, like if you're tight on the inside of your knee, if you can get a good physical therapist to stretch out the structures that comprise the inside of the knee and then strengthen the structures on the outside of the knee, you can affect alignment, reduce pain. Also, a stronger joint is a stiffer joint that is more hydraulically able to withstand compression. So a weak joint, kind of all over the place, right? You have no way to control it. So your contact stresses are going to be abnormal and hurt. So the strength is important for that reason, to control motion. And then also you can actually think of it like a hydraulic lift. Like it makes it bounce better and controls the impact. And then opposing muscle group balance, right? So flexion, extension. A lot of reason people get arthritic pain in the neck is because they're like this all day long, all day, never stops. And then they wonder why their neck hurts. So a lot of the things we do is develop strength and training programs to open up the front of your body and strengthen the back, and that helps to reduce neck pain. Yoga is amazing for that, believe it or not. But even just some stretches of the pec minor and different thoracic muscles helps a lot. And then endurance, and that's where the walking and the exercise comes into place. If you have a strong muscle, but it fatigues after 1 minute of use, that's not very functional for you, right? So you need a muscle that can work for you all day long. And that's why exercise comes into play in keeping your inflammation and oxidative stress low, like your lactic acid levels, things like that. Somebody's asking about nightshades, and I think this goes with that book. I think it's called The Longevity Paradox. That's a certain type of plant that some people don't process one or two of the phytochemicals in it. That's kind of specific to certain people only. I mean, I eat nightshades all the time. So that's kind of a difficult question to answer. That's on a person by person basis. But there are a few people that can't process certain phytochemicals due to lack of an enzyme or allergy, almost like gout. Like with gout, you don't have the ability to process the xanthine properly, and you end up with urate crystals in your blood that then deposit in the joint. And that's found in like shellfish and meat and things like that. So I think of the people that have problems with nightshade are kind of in those kind of groups where you have very specific dietary requirements that aren't universal. But so I don't personally have an issue with nightshades, but I don't have that problem. But there are some people that do. Can we get past this slide? Hold on. Okay, so these are the lines that I'm talking about. This is what we work at in my clinic. And this is why I just love the human anatomy. So if you look at these pictures, you can see how one muscle just drops into another muscle, and makes a whole functional unit, right? Like your pec to your biceps, to your forearm, to your finger flexors. So you may be able to treat a problem in your wrist by stretching the pec, okay? Because you're gonna loosen it up indirectly and make it feel better. And then this is where fascial stretching are a really good deep tissue massage therapists. They understand these fascial lines, and they'll work the whole line to make you feel better. And then these lines, look, we already talked about the one there, the superficial back line, from the top of the skull to the bottom of the foot. So you can treat plantar fasciitis pain by doing a massage along the back, because you're going to effectively loosen it all. Or the Achilles, which is really, we should all stretch our Achilles every day. I think the number is something like 95% of Americans have Achilles that are too tight and cause problems. You can see that front spiral line, how everything is interconnected. And then the spiral line that goes from the outside of the leg up through the thoracic fascia to the shoulder, you can actually have a left shoulder problem associated with a right hip or right knee dysfunction or malalignment. And it just takes a really trained physical therapist or physician that understands this to see that and tell you how to affect treatment and how to get an effective strengthening and balancing program. So if you look at the spiral line person and the superficial back line and the superficial front line, now try to picture in your head, what if you had scoliosis? What if your spine were curved? Well, obviously one side of that spiral line is going to be super, super tight. One's going to be too long and weak. So you need to modify all of your programs to address those deficiencies. But once you understand all of this, you can treat the pains and symptoms of arthritis just by making the fascia around the joint work for the person better and the muscles work for the person better. So that's sort of our focus in terms of the physical medicine that we employ. And then offloading. It's a tried or true method of treatment for pain. So this is why knee braces work. Now, a lot of doctors poo-poo bracing. Personally, I don't, because to me, it makes perfect biomechanical sense. If you get a decent knee brace, look what it can do. It will actually open up that joint and take pressure off of the area of pain and the area of damage. And what does that do? It reduces your symptoms, makes you able to function more, and then also gives your body a chance to heal that area. Your body's never going to have a chance to heal that medial compartment of the knee until the bone is not crushing on the bone. So this is why I love braces, and there's a ton of braces for all different body parts. Still not a good hip brace, but maybe one day there will be. But knee braces are great, and we use them all the time. Oh, yeah, people are talking about turmeric. I'm a huge fan of turmeric. My joint health multi is turmeric, piperine, ginger, and PEA. And now, surprisingly, we're about to talk about PEA, so that worked out well. Turmeric's just awesome. You should take it anyway for heart health, gut health, just health. I take it for personal wellness, but it is awesome for knee arthritis. And it's been studied head-to-head with anti-inflammatories. Ginger's been studied head-to-head with anti-inflammatories, and they are as effective, if not more, much more natural, much safer. So I love when people tell me they're taking turmeric, and I know they've got a great chance of getting better because they're already on the right track. So PEA, I love this molecule, palmitoyl ethanolamide. I learned about PEA in my research on CBD and medical marijuana. It's a similar molecule to anandamide. These are fatty acid amides, okay? Anandamide is the bliss molecule, which is what CBD upregulates in your body. Palmitoyl ethanolamide is just another one. They both act synergistically to reduce the levels of FAAH, which is the enzyme that breaks down anandamide and breaks down 2-AG and the other ligands or keys to the endocannabinoid system. So think of PEA as an analog to CBD. It works just the same way, but it's not derived in the marijuana plant. PEA is actually produced by you every time you get hurt or injured. Your body upregulates the amount of PEA to reduce the inflammation around nerve endings. We're going to talk about that in a minute. But PEA basically attaches to the same receptors that CBD and THC do, the G protein coupled receptors, which there's a gazillion in the brain. Well, not a gazillion, but you know what I mean. And then the peroxisome proliferator activated receptor. So this is a genetic modulator of inflammation, hugely important, and PEA modifies that to your benefit. And it's all natural. It's a great molecule. You make it yourself. We just don't make enough because our diets are so terrible. We don't exercise enough, and we're surrounded by pollution. So I help myself out and take PEA every day. Next. And PEA is well known. It's used in Europe all the time as sort of a prescription to treat arthritis, neuropathic pain. It's been used for, 60, 70 years, very safely, extremely safe. This is sort of the circle of what it can treat and very effectively. So I use it a lot for inflammatory pain for people. We have it in our topical pain cream too, because it reduces that hypersensitivity, the peripheral sensitization we talked about of inflamed nerve endings. And then you can just really use it for a lot of different conditions. You may say, well, how can something work in all of these different conditions? Remember, we're going to the root cause of all these problems, which is chronic inflammation and oxidative stress. I preach it every day, all day. That's how the Mediterranean diet works. That's how exercise works. That's how sleep works. And that's how natural medicine works. You're reducing chronic inflammation and you're reducing oxidative stress. Therefore, the root cause of all of these problems goes away. That's why I love all of this, because you can really, it's not Band-Aids anymore. You can actually get to the problem. So PEA is water soluble. It acts like CBD. We talked, it's been clinically tested. It's generally recognized as safe. It's anti-inflammatory, supports the immune system. And again, it's endogenous. That means you're making it right now while we're talking. Your body's probably making PEA somewhere for some reason. We just don't make enough of it. Another question.
Celiac disease, so turmeric isn't safe to use. Is there a replacement that is gluten-free?
Okay. Somebody asked, let me see if I get this question right. They have celiac disease, so they can't take turmeric, and they want a gluten-free alternative. So turmeric is derived of, that's a root that I guess gluten deep in the plant root. If you get the pure curcuminoids, like the extract of the turmeric, and it's not like curry, I don't see why you couldn't take turmeric. Actually, turmeric's a great treatment for Crohn's. The curcuminoids are the phytochemicals found in turmeric, which is why it's so powerful. Those are gluten-free. So I think if you just found the pure curcuminoids and it was in an oil-based delivery system, that might work because there's no gluten there. But if you're trying to avoid the tuber or the root itself, meaning, you know, like a potato's a root, that's where turmeric comes from, then you would get the products that are a highly purified curcuminoid base. Like ours is 95% curcuminoid, and then we add piperine for absorption. A lot of times you need to take it in oil for absorption, or you have to add black pepper to increase absorption. But I think if you took the more purified form like that, you would be fine because there shouldn't be any gluten in it. What? Oh, replacement? I mean, ginger. Ginger's it's great for the GI tract and it's great for pain. Tart cherry is another gluten-free, obviously, because it's a cherry. That one is good for pain and actually should not damage the gut because it's a COX-2 inhibitor, but in a much more natural way than Celebrex is, or Vioxx, if anybody remembers Vioxx. What else? To replace the benefits of curcumin. PEA, of course, which we're talking about here, CBD, marijuana might help you, or THC. I mean, they have great anti-inflammatory benefits. And then I think just any kind of berry diet, berry-based, to get the antioxidants like blueberries, things like that, strawberries. The berries are a great source of antioxidants. Resveratrol, you could get that from peanuts and or grapes. And there's, you know, red wine has a real good amount of resveratrol in it, but I don't know if celiac, you're pretty sure you're allowed to have red wine because there's no gluten in it. But straight up resveratrol obviously has fewer calories and no alcohol, so that's another way to go. This is the nervous system multi, this slide, and you see we have resveratrol, PEA, omega-3 in it. Omega-3s are highly anti-inflammatory. The PUFAs, those should be good in celiac disease as well. Chlorella is green algae. The reason I put green algae in this is it naturally pulls out heavy metals and helps to detoxify the brain and nervous system, which does what for osteoarthritis? Reduces pain, because again, all pain is an electrical signal. If you can make those electrical signals more balanced and keep it from going from peripheral sensitization to central sensitization, then you're helping your pain. Luteolin, a great antioxidant as well, and N-acetylcysteine. When N-acetylcysteine was traditionally used in medicine, it's for Tylenol overdoses, believe it or not, but it's extremely antioxidant, very neuroprotective, and it too helps to modulate and modify the nerve circuits and reduce pain. So all of these meds in this nervous system multi help pain because they help the nerves function better. And omega-3s, PUFAs, we talk more about that in the Mediterranean diet talk. I just love omega-3 fatty acids. So I just think everybody should be on that if you're not, or you should start eating a lot of wild-caught salmon if you can, or herring. I don't like herring. I don't know if you've ever had herring. That's tough to eat. But you know, so I take it as a supplement because it's just much easier to get it that way.
Damage of osteoarthritis be slowed by diet change and supplements?
So somebody just asked, can the damage of osteoarthritis be slowed down by diet change and supplements? Yes, it can. Almost all chronic diseases can. You can reverse diabetes with diet change and supplements. You can change your cancer profile. You can handle inflammatory conditions like Alzheimer's, Parkinson's, et cetera, with different dietary changes. The primary way to age well is to have few animal proteins and a lot of phytochemicals and fiber. So what is that? The Mediterranean diet or a heavily plant-based diet. So yeah, if you can convert to that and stop eating highly processed food, you will definitely slow down the progression of arthritis. And then the supplements come into play because unless all you do is go out and find locally sourced vegetables and eat 9 servings of locally sourced, organic, non-processed vegetables a day and make your own bread with your own milled flour and avoid all processed foods, there's really no other way to get all of the nutrients you need, the micronutrients. That's why I supplement. So supplementation is important unless you're able to physically do the diet the way it should be done, which I find nearly impossible. I do the Mediterranean diet and then supplement on top of that. Okay, so we talked about all of this. So pain relief with the well theory is really just focused on, again, the core principles, which are reducing chronic inflammation, reducing oxidative stress, giving you the micronutrients that you need for every cell to function at its optimal level, every mitochondria to make the most energy in the safest way with the fewest free radicals or radical oxygen species that damage. So that's the whole point of all of the natural products that I have and that a lot that are on the market. The whole point of exercise, the whole point of the Mediterranean diet. And then if you add to that, getting your machine tuned up and getting it balanced with decent core strength, and then walking a little bit for endurance and preventing muscle loss, I think that you'll find that you'll feel better. Your arthritis won't hurt as much. You'll keep your arthritis from progressing. Maybe you'll even avoid ever needing a surgery or steroid injection, and you'll age well, which is what I want to do and what I want for everybody else. You'll have a nice, functional, beautiful health span and just be hiking up until the last day. That's what I want for everybody. Any more questions? This is my team. Couldn't do it without them. Very, very caring, devoted staff. I think everybody's getting ready to go watch the football game or tailgate. I think we're good. Hopefully that offered you like at least an sort of an understanding of what arthritis is, what does it feel like, why does it hurt, what are the molecular basis of the pain, and what can I do to keep it from getting worse. And then, you know, there's a lot out there to read and learn. So just make sure you read from good sources, but you can do a lot for yourself and stop this from happening, or at least stop it from getting worse. All right. And again, we're in Baton Rouge on Airline Drive. This is my number and website if you ever want to come get an analysis or, you know, if you think you have arthritis and you feel like you might need treatment. And again, there's a whole host of treatments that don't have to involve a scalpel and anesthesia. They're available. But if you need a total joint replacement, you need it. And they're great surgery. All right, signing off. Have a good one.